That's the dead giveaway. Is often it's quite achy in one particular area, really small area.
So is it like pinpoint area when you say
can
really
kind
small?
of go, look, I feel like it's somewhere around here, you know.
We're here with Dr. Bojana here at Box Hill South Dental. Thanks for joining us.
You're very welcome.
So Box Hill South Dental team is not only responsible for caring for your smile, but also for caring for the individual patient. And our dentists and staff are warm, gentle, nurturing, and understanding. Bojana has been a dentist for quite a while and has been helping out the local patients to achieve healthier smiles in the local community since 2016. Is that right? This practice, this premises here is super fresh, right?
Yeah, so we've been here since November last year. Very minty fresh, still has a fresh smell as my kids walk in and tell me it smells like a new house. So we've been here since November last year. So that was a big move.
Bojana is a doctor of dental surgery from the University of Melbourne and has a Bachelor of Pharmacy from Monash as well. I'm also just going to add in that also a mother of 3. I feel like that should be added in.
Yes, that's my biggest job. Yes, so dentistry is my passion. Being a mother is my job at the moment.
I see. So, because there can be quite a bit of overlap if we get pain in, say, this area through here. It could be dental or it could be musculoskeletal. It could be a lot of things, but let's just stick with dental and musculoskeletal at this point.
Yeah.
If I had a tooth dysfunction or dental problem in this area, how might that present? And what might be a dead giveaway that it is a dental problem in contrast to a bone or muscle problem?
Okay, so teeth are very simple beings and they give you some pretty strong pain if they're not happy. And probably the dead giveaway would be aching, throbbing pain that perhaps you take some Nurofen and it goes away, but then it comes back with a vengeance. And often it's the worst at night. So often patients will come and say, I'm waking up in the middle of the night, or as I'm going to sleep, the pain starts. And it's a very aching, throbbing pain in a really small localized space. Occasionally it radiates, which means it kind of starts in one space and then it just zings into other areas. But when someone comes and says, my whole face hurts or this whole big area hurts, we will look at teeth, but often we find nothing. And we say, look, let's look at other structures around, like your muscles and your bones and your jaw joint and things like that. So that's the dead giveaway. Is often it's quite achy in one particular area, really small area.
So is it like pinpoint area when you say
can kind of go, look, I feel like it's somewhere around here. You know, they'll point to some specific teeth and they go, I can't work out which tooth, but I think it might be one of these teeth.
Right.
And then it aches and throbs there and it gets a lot worse at night and in the middle of the night especially.
And if I, as a patient, if I pushed on my own tooth, would that hurt?
It depends. It depends what nature of pain it is. But often the things that we're looking for are pain to temperature differences, so really hot and really cold.
So ice cream.
Ice cream, hot coffee. I can't have that hot soup that sets it off. And often they will find that it kind of starts off from one tooth and just like throbs there. And also pain to pressure. It's usually food. So generally we're not poking at our teeth ourselves, but yes, we do have a push around to see if we can identify, but it's food, so it's chewing actions and motions. So usually people will say, after I've eaten or drank this, or after I've chewed this, it sets it off, and then it lingers and it aches and it carries on for a little while. So
when you say a little while, is that hours, days?
It can be from minutes to hours. Okay. But
it's coming back in that PM.
Exactly. And it's coming back really with a vengeance at night. But those activities very occasionally might set off a jaw pain, for example. So if I've had a really crunchy food and then I get a general ache around here. But if I kind of have that chewing motion and I feel like something within my mouth is hurting and it's throbbing and aching in a very small area, we often think it's a tooth.
Okay. Let's say can't enjoy my ice cream and it hurts and it's hurting in one kind of specific spot through here. So I'm here in the dental chair. What might kind of an assessment look like?
What I'm looking for is, before I even look in your mouth, we have a big chat. So your experiences as a patient are sometimes far more important than what I can see or what I can test. So we'll have a chat about what your pain looks like. Is it really severe? Is it a dull ache that just carries on, low grade? What sets it off? So I have my ice cream, that sets it off. How long does it linger for? Does it stay around for a second or it goes away straight away? So with all that information, then we'll look in your mouth. We have you open for small periods of time, checking specific areas. So we're really looking at that tooth that we think it might be. We look at a couple of other teeth around just to cancel them out and make sure they're okay. And basically
So can you see it?
So if someone's got a big hole, you can see it, right? If we can't see anything that's wrong and we can't see any cracks or holes, then we go, look, I'm going to tap on your tooth gently. This is what a normal tooth feels like when you tap. This is what perhaps your sick tooth feels like. And then we tap and see, does it invoke any kind of response? No, that feels fine. Great, we move on. We might then just take a little cold cotton pellet and put that on the tooth. We put it on a healthy tooth and just say, look, this is your normal healthy feeling. When you put cold on, it kind of goes, and then it feels fine. And when we put it on the sick tooth or the tooth that we suspect might be causing you issues, you might either feel more cold, more pain, or you might feel nothing at all. So we use that information to find out what might be wrong with the tooth. And lastly, the very most, we might get like a little blunt-ended probe. So it's like a blunt-ended stick and just check around your gums and make sure the gums don't have any infections. But that's about all we do in the mouth. Outside the mouth, we might actually do a little x-ray if we feel that we might have some sort of infection and we might need more information. That's not painful. It can be uncomfortable having things in your mouth and having bits of plastic and paper. It doesn't taste nice, but it's not painful. And it's really quick. We do it in the chair. And if someone has a very painful infection and they don't even want to be touched, well, that kind of just gives us our diagnosis as it is. And we don't have to do a lot of poking and prodding to begin with.
Okay, but you're probably going to do a scan.
Yeah, you probably do an x-ray, which is, again, not painful, but it just feels weird having things in your mouth.
And let's say you've checked my teeth and they seem fine. And now you're concerned about my jaw. What does that look like from your perspective?
So that's such a big area.
I know.
Such a loaded question, such a big area.
Here we go. Really
but
simple question.
If we've cancelled out any kind of teeth-related issues, the other thing I might even look at and discuss with the patient before we go, is it your jaw, is we talk about whether or not they've had any sinus issues of recent. So for example, if someone comes with a lot of pain up here and they go, oh, it's on both sides, we go, have you been sick? Oh, I've had a really mad cold and my sinuses are really blocked up. We go, okay, maybe you don't have tooth pain, you might have sinus pain.
Sinus pain.
So that's a whole nother thing that we rule out, and it's a typical winter presentation, winter, hay fever time. But if it's not that, let's say it's someone's kind of, around their ears, around their jaw joint, around the muscles underneath here, sometimes those top muscles as well, then we go, look, you might have jaw pain, you might have muscular pain, you might have jaw joint pain. And then we look at why is this actually happening to this patient, and we ask a few questions about things like, what's going on at home? Are you really stressed? Is there a lot happening? Are you grinding your teeth when you sleep? Are you clenching your teeth while you're working at the computer because you're really stressed out and you're concentrating? And often there's a bit of a backstory. And then we go, okay, let's talk about this. And we see whether or not they need to see a muscle worker like an osteopath, for example. And at the end of the day, all those muscles and all those joints are kind of not too much different from anything else. If you have a sore ankle, you're not going to walk on that ankle. You're going to give yourself a bit of a break. You're going to change your behaviors. You're going to get some treatment to help with that. So we have to look at all of those things because there's no one injection or medication that we can use to fix that. It's a whole big Pandora's box, basically. But if someone has got pain and they've got dysfunction, meaning they can't open their mouth wide to have that sandwich because everything is so sore and they're locked up. They're not going to eat deconstructed sandwiches for the rest of their lives.
No,
they need to see someone to get help. On occasions, it's not that frequent. I will say, look, you're actually grinding and clenching your teeth so much, you're causing a lot of damage to your teeth as well as giving yourself pain. We need to look at making you perhaps a dental mouth guard that you wear when you sleep to protect your teeth. It's kind of like using some crutches. You use it on occasion to take a bit of load off to protect your teeth, but it's not something I have many people wearing full time.
So it's not the thing I wear on the soccer field?
No. So a dental mouth guard that you sleep with at night, it's a harder mouth guard made of plastic or acrylic. The process of getting it is same as the one that you get on the soccer field. We take a mold of your mouth. We don't take those molds while you have lockjaw, pain, things like that. So that is something that we discuss and look at when you've kind of recovered from this bout, when you've had some treatment, when your jaw is feeling a bit better, and we go, okay, let's look at this. You're having, you're grinding and clenching your teeth a lot, and you get into these times when you spasm, but you're breaking teeth, you're wearing down your teeth. Let's look at, can't have that, but let's look at making that when the dust settles.
Sitting in the dental chair going to make my jaw pain worse. Should I be concerned about this? You mentioned before, when you have the patient there in the chair, you're not keeping their mouth open for very long. I'm not going to be sitting there with my mouth open for 20 minutes.
No. So your jaw will probably be more sore from chatting to me about your symptoms, because we do more of that.
Okay. More talking.
Yeah. Because before I even look in your mouth, I need to know, what am I looking at? I don't want to waste my time looking through 32 teeth trying to figure out which one's hurting you. So we take all that information and go, okay, I feel like I know what I'm looking for. Let's have a look and target the diagnostic tools that we need according to Fontaine's symptoms. You're open for short periods of time for me to check and look, and then I get you to close and relax.
Okay.
If someone has jaw pain, I want them with their mouth open as little as possible, because I don't want to make that worse for them. And I don't want to be doing any treatment for them while they have jaw pain as well. So for example, I had a patient yesterday who came for a regular checkup and clean. And she said, look, I'm actually having a really bad episode. I feel like I can't open my mouth very wide, but I do just want to check my teeth because I have pain in this tooth. And I said, well, let's just check your teeth today. We're not going to clean, because if you're in my chair for the cleaning, you're going to be open for minutes at a time.
And that's going to
So it's about delaying that treatment and going, what do we need to do right now? We don't need to clean your teeth. We just need to do the bare minimum.
Yes.
And then when you don't have jaw pain, we bring you back for any treatment. Yeah. So no, you won't be open for long periods of time, but and we do things within reason. So I don't need people to open super wide, which is what usually makes your pain worse. When we're just checking a couple of teeth for some symptoms.
Hang on a minute. So you said I don't have to sit there with my mouth open as wide as I can?
No. And often I tell people, you're opening too wide.
Okay.
We're okay. We don't need all that visibility. You can close down to your comfortable spot.
Well, that's excellent.
Yes. Patients often overcompensate, and they get in the chair and they just want to open as wide as they can and be really compliant and you know, make the dentist's life easier, which is amazing. Thank you. But we don't need that. We need to work within the patient's limitations.
Right.
Yeah.
Well, that's interesting. Yeah, I learned something. I learned a handful of things.
We'll chat about that later.